Hello, everybody. How is everybody today? I have some exciting information to share about a new diet that we're going to be implementing with a number of you. It's called the FMD, which stands for Fasting Mimicking Diet. Fasting Mimicking Diet. That's what we're going to be talking about today. Now, it's only a short term diet, just not to scare you. Everybody gets scared with that D word. Um, but it's a diet that can be implemented, it's supposed to be implemented 5 days of every month for 3 months, and then off for 3 months, and then you do it again. So it's done 6 times a year then. That would be the normal progression of this diet for only 5 days each time. So it is not something that you stay on long term. It is actually a kit that you see in this picture right here, but we will go over it in detail in this presentation. So a fasting mimicking diet is based on getting your body in a fasting state. So in a fasting state, these slides are taken from the University of Southern California, so give them credit for that. But in a fasting state, we talk about the evolution of a fast. In the past, we were dependent upon hunt and harvest, and even though I'm not an evolutionist per se, you could even say in biblical times, there was times that we went where we didn't have a lot to eat. So there was days that you didn't have a lot to eat, and there was benefit of that. Even in biblical times, fasting was something that was done for religious purposes on a very regular basis. So these patterns of fasting or lack of food forced um, our body to be able to survive during periods of hunger. And there's huge benefits to going through this, but it's very difficult. So there's a new concept that actually makes it much better. That's what this fasting mimicking diet is all about. When food is scarce, when we're not eating, the body acts to conserve energy, and it diminishes, it decreases, it downregulates multiple pathways. And some of the key nutrient pathways that it downregulates is the PKA pathway, the mTOR pathway, and the IGF-1 pathway. Now, these are all pathways that are highly inflammatory and that are upregulated with cancer patients. So this type of diet fits perfectly with cancer patients. There's multiple clinical trials going on right now with cancer patients and this diet, and they're all coming back promising. It's really, really cool. So these pathways you've heard me speak about in multiple other presentations, things that we're trying to downregulate. Well, uh, fasting mimicking diet, the FMD diet, downregulates these pathways. So it's really, really exciting. So, um, fasting is actually accompanied by an increase in desire to move. You think, oh, if I'm going to fast, I'm going to be just groggy on the couch. But actually, when we're hungry, we want to get out and find food. So it actually is a great kind of stimulation for our body. So, um, but the problem is, again, it's difficult. So, the body identifies the presence of food through these specific nutrient sensing pathways. So, downregulating these pathways, especially the IGF-1, the mTOR, and the PKA pathways, basically starves cancer. And this isn't just for cancer. The studies are also on autoimmune disease, MS, Lyme disease, some studies that are upcoming on Lyme disease, but any neurodegeneration, Alzheimer's, and Parkinson's, it's unbelievable the results that are coming back on these. But the difficult thing about fasting, the difficult thing about staying away from food is that it, it's hard to get somebody to do it. It's not easy. And it's not always safe for periods of time because if I'm completely staying away from food on a water fast, that will downregulate those pathways. But the problem is my body will kick into what's called gluconeogenesis, and I'll break down proteins in order to make glucose. So I'll actually start breaking down my muscle cells in order to start making glucose to feed the glucose nutrients in my body, or the glucose demanding cells in my body, including the cancer cells. So uh, that's where the FMD diet comes in. This is the doctor who discovered it. I actually met him this weekend. He's a great guy. He's the one who's pioneering all this research uh, through the University of Southern California. Tons of money is being poured into this research, and it's just some really cool stuff. At this time of this video, it is in December. His book is not coming out till January. So it is on pre-sale on Amazon if you want to grab it. You have to look up his name there because I forgot on this slide presentation to copy and paste a picture of his book on here. So fasting, mimicking diets, FMDs, downregulate the body's key nutrient sensing pathways. And these are key pathways for cell replication. That's how your body heals, remember, through that whole mTOR pathway. And that's how your body creates replication cycles through that mTOR pathway. The mTOR pathway is what's upregulated with cancer patients. So if we can downregulate the mTOR pathway, we are decreasing the cancer's ability to replicate. So using a very, very specific combination of low protein, low carbohydrates, and low sugars, and some fat, FMDs help to move food into the body without releasing any of the signaling factors. So doing the FMD diet, you can continue to take supplements, but you cannot continue to take any green drinks. No other foods. No cheating on this. So the stomach sees the nutrients that we're putting in there, and they're very specific. we have to stick to it in detail with what's in the box, and I'll show you that in a little bit. But for those 5 days, it can change that whole system. And the argument is, well, great, if it changes, if it downregulates my mTOR and IGF and PKA pathways for 5 days, that's wonderful. But what happens after that? Well, that's the really cool thing about this, is that it keeps them downregulated for a long period of time. The testing, though, on all the studies that you were going to see in just a little bit, all the studies were done doing 5 days a month for 3 months. So it's only 3 cycles of 5 days of the FMD once a month for 3 months. And the studies, all the labs were run on these patients out 6 months, and they still showed low growth factor tests, low mTOR testing, and all the other parameters that they were testing still maintained low, going back on a good healthy diet, which I have you guys on already. So you don't go back and eat hamburgers, but you're going back to eat what I already have tested you on. So you're foregoing the diet that I gave you for 5 days, going on an FMD diet for 5 days, once a month for 3 months, and then going back at the end of that 5 days to the diet that I gave you. So is it difficult for 5 days? Well, it's not going to be as easy as eating normally, but you're given food to give you satiation of your appetite. Normally, people are eating normal foods, which are technically high in protein, high in sugar, high in carbohydrates if you live in the United States. Even the diets that you're on are relatively high in these things. Well, you could say, I'm not eating any sugar, I'm eating any carbs. Well, you're eating vegetables, so you're getting carbs, and that's breaking down to sugar. That upregulates IGF-1, upregulates insulin, upregulates mTOR, upregulates the PKA pathway, and it upregulates cancer growth. It upregulates immune response to with an autoimmune disease, with Lyme disease, etc. The 5-day FMD is very low protein, very low sugar, very low carbs, but not to the point that's going to stimulate gluconeogenesis. That's the key to this. If we just do a 5-day water fast, that can be great, but it can stimulate gluconeogenesis, and we negate the benefits of the water fast. So we have to stay within a parameter that we are decreasing the IGF-1, insulin response, mTOR, and the PKA. So we're going to optimize aging. We're going to optimize a decrease in autoimmune response. We're going to optimize a decrease in cancer growth. And again, as I said, how these work, you're on it for 5 days, and there's different phases that your body's going through. The first couple days, it's what's called an induction phase, on how your body's starting to respond to this. Then you start to get cellular protection mode, DNA and stem cell priming, what they found, and then rejuvenation and regeneration goes on from that point on. And like I said, the studies were measured out 6 months. So I want to do a cycle of once a month for 5 days for 3 months. So you're doing 3 of these, and then off for 3 months. You're staying on the regular diet for 3 months that I gave you. And if you're doing well, you can choose not to do it again. But if you want to, again, prime the system, again, to keep in that low mTOR stimulating function of your body, then we want to do it again for 3 months. So you would do 6 cycles of these a year if you really want to optimize your chances to reducing mTOR and IGF and PKA levels. It's very exciting for a lot of patients, not only cancer and Lyme patients. It's very exciting for a lot of patients. There are numerous studies, and I don't have time to go over all of them, but there was numerous studies done through USC on this, on what it does to visceral fat. And you know that visceral fat is where we hold our toxins. What it does with neurogenesis. There's more and more studies on neurogenesis coming out because of Alzheimer's and Parkinson's and MS. It reduces autoimmunity. It alleviates MS symptoms. There's show that oligodendrocytes are regenerated through this diet. It's really, really interesting. So anybody with brain cancer, this is a great diet for them. Matter of fact, they compared this diet to a ketogenic diet with MS patients. And ketogenic diet did much better than the control diet. The control is in red. Ketogenic is in the dark blue. In every factor except one where it was near equal, the FMD did much better, sometimes 3 times better, than the ketogenic diet. So a ketogenic diet is much harder to stay on, and you're having to stay on that constantly. So doing a more keto-like diet for the MS and brain cancer patients, while doing this once a month for 3 months, it would be much easier to do than to try to stay on a full ketogenic diet and full ketosis for basically for life. This is a much easier thing to do. There's also a process that's called immunosenescence. Immunosenescence speaks of as we age, our immune system decreases. And as we age, we end up getting a shift in our lymphoid to myeloid ratio. This is a type of white blood cell, excuse me, that we have. That is why we get an increase in AML diseases as we age. AML is a type of leukemia. So this would be a perfect diet for all my AML and lymphoma patients as well. That shift to myeloid shift in the lymphoid to myeloid ratio is called immunosenescence, and that is one of the theories on why cancer increases as we age. The rate of cancer increases as we age. So that's obviously not true in all cancers, but it does fit this whole piece. Doing a functional medicine or an FMD diet with uh, 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 myeloid type patients, meaning multiple myeloma patients, AML patients, and lymphoma patients. The FMD diet affects the stem cells. We're not talking about circulating tumor cells, but the healthy stem cells, and it creates a shift back, um, giving a healthier ratio, that lymphoid to myeloid ratio. And that was really neat and very promising for the leukemia patients. There's multiple studies with FMD and cancer that I can't go over. Unfortunately, most of those studies, the way they're getting funded, are they're using them with chemotherapy. But it's really cool. And if you're currently on chemotherapy, we need to speak individually about this because there's a little bit different parameter on how you do it. But a decreased calorie intake on an FMD diet is shown to not only decrease IGF-1, it decreases insulin, it increases cortisol, it decreases sex hormones, which can drive cancer. So on any cancers that are hormone driven, so any prostate, any breast cancer, any ovarian cancer, any uterine cancer, this is a perfect diet for this. It decreases oxidative stress, decreases inflammation. Um, so the studies are very, very promising on this. The thing with cancer is there's what's called a differential stress resistance in cancer. Normal cells, if you go on an FMD diet, short-term decreased calorie diet, uh, the cells are protected. But tumor cells don't have that same protection, and tumor cells then decrease growth and die. So it is an excellent diet for all forms of cancer, except childhood cancers. It's very difficult to do this with a child. So the trials have been extremely promising. They've been shown to be fantastic for diabetes, for coronary vascular disease, for cancer, and just to help with aging and to decrease the symptoms of aging, arthritis, and immunosenescence. So, uh, uh, this is just more data on what is done on these clinical trials. Remember, these were all done over, this is the final after 6 months on trial when these people only did it 3 times. So decreased body weight, the darker color here is after the 6 months. The lighter color is how they began. Decrease abdominal fat, waist circumference, lean body mass, decrease IGF-1 levels, blood pressure levels, cholesterol, C-reactive protein, which is an immune marker, and healthy stem cells. So it's I'm very excited, obviously, about this and it helping a lot of my patients. I'm going to be going on this diet, so I will report to you what I feel also. Has a lot of benefits beyond cancer and beyond any brain issues and autoimmune issues, and Lyme issues. But understand you're on the diet for 5 days, and it is each day there's a box in the kit for what you are going to eat. It's all powdered, and you're going to use that for 5 days. I have tasted some of it already, and it's great. So I'm excited about it. Again, you're on it for 5 days, once a month, for 3 cycles. And in between that, you go back to your normal diet, the diet that I have given you. Interesting, with these patients on the study, they weren't put on any other special diet at all. They were on their normal diet, which some of them were eating pretty crappy. So I'm sure, just like a general cohort study of a population group, some people normally eat real well and some people don't eat real well, and still the results show that. It's not giving you kudos to eat whatever you want. But going back onto the diet that I gave you, I'm really excited what we're going to see in this. This is what it looks like. It comes with a box. In the box, in the large box, there's 5 boxes with an instruction manual, and there is, you take out box number 1 for day 1. Each one of the days are slightly different, and it is engineered specifically to diminish and reduce any gluconeogenesis. So you have to follow it to a T. You can take your other supplements with it. You have to. I want you to. And this is going to be done on an individual basis, so you need to consult with me. You don't just purchase this from our store. Now, I purchased these at a discount. You could go on Prolon's website. That's the website right there. That's the name of the company. You can see it, Prolon, and you can see a video, and you can see a bunch of information, and you could theoretically purchase it from them, a kit from them, 3 kits from them, and do this. I get a discount, and I'm passing the discount on to my patients. So I'm not looking to make a penny off of this. So it's better to get it from me, and if you're my patient, I want to make sure I watch you through this so that you're not just jumping into this. Now, this video is going out to a lot of people that may watch this, and you have to do it with your doctor. So I suggest highly that you get doctor's approval, and you do this in a company by being tested and being checked and making sure that you're speaking with your doctor. So the kit comes with the 5 small boxes. They're all plant-based. They're all organic. They're all no additives, colorings, nothing like that. So I checked all that out. The ingredients give you about 800 to 1100 calories a day. That will keep you from gluconeogenesis. And I tasted a couple of the bars. They were actually really super good. And you follow it for 5 days, and then you're back on your regular diet. And then you do that again in 1 month. So you got to time this, around family gatherings and things like that, and so that you can make sure that you get it on your calendar that you can do this. Set up an appointment with me to talk about this. It may not be appropriate for you. There are some precautions. You want to be careful of that, and go ahead and read these. Obviously, it says don't operate motor vehicles, yada, yada, yada. They say that with everything. But, you might be a little bit more lightheaded. Your calorie restriction is dropped down. You might be used to eating 2,000 calories a day or more. Dropping down to 800 may make a difference. Typically, people are not more tired, but like I said, but you may experience those things, and you just have to be careful of that. There is some exclusions, people that should be excluded out of this. So I'll let you read these. Children are going to be excluded out of this. Women who are pregnant and nursing. If you have allergies to nuts or soy, because there is some of that in there, in order to get to that specific calorie count and everything. So that would eliminate you. Again, contact me. I'm excited about this and using this for some of our patients. So contact me and set up an appointment. All right, hopefully this is very helpful, and I'm just praying that this is going to be a blessing to a lot of our patients. Bye-bye.